5,000 years ago, a person could lie down on a stone floor with a hole in their skull, surrounded by people who had no anesthesia, no antibiotics, and no modern surgical instruments. And somehow, some of those people survived. Their bones later revealed something even more disturbing. The wounds were not always accidental, and some showed signs that the bone had begun healing afterward. Someone had deliberately opened the human skull using primitive tools, then somehow kept the patient alive long enough to recover. So how could humans perform surgery thousands of years before modern medicine even existed? Long before hospitals and operating rooms, ancient humans already understood that the body could be injured, treated, and sometimes deliberately altered to save a life. One of the clearest examples is trepanation, an ancient surgical procedure in which part of the skull was removed, scraped, or drilled away while the patient was still alive. Archaeologists have discovered trepan skulls from prehistoric communities across different parts of the world, including evidence dating back thousands of years. What makes these discoveries remarkable is not simply the hole in the skull, but the smooth edges and signs of bone healing found on some remains, suggesting that the patient survived the operation. But surviving the cut was only the beginning, because the ancient surgeons still had to face a problem that modern medicine spends enormous effort controlling. What happened next?
Without modern anesthesia, ancient surgery would have been brutally painful, so the procedure likely depended on speed, restraint, experience, and whatever natural substances were available in that culture. Different societies developed different medical traditions, and some ancient cultures used plants, fermented substances, or other preparations for pain and healing, although we cannot know exactly what every prehistoric surgeon used. The tools were primitive compared with today's instruments, but primitive did not necessarily mean careless. Sharp stone implements could be surprisingly effective at cutting or scraping bone. The surgeon also needed enough anatomical knowledge to avoid causing catastrophic damage, because the skull protects one of the most delicate organs in the human body. And that raises an extraordinary possibility. Perhaps the first surgeons were not experimenting blindly at all, but were learning from generations of painful experience. Imagine watching the same procedure happen again and again across generations, with every mistake carrying a terrible cost, and every successful recovery becoming knowledge passed to the next healer. Ancient medicine was not built from textbooks and laboratory experiments, but observation could still reveal patterns: which wounds became infected, which treatments seemed to help, and which injuries people could survive. Archaeological evidence from ancient societies also shows that surgery was not limited to the skull. Humans eventually treated serious injuries, set broken bones, removed damaged tissue, and developed surprisingly sophisticated medical practices. In ancient Egypt, medical texts such as the Edwin Smith Papyrus later recorded detailed observations about traumatic injuries, showing that some physicians approached wounds through systematic examination rather than pure superstition. Yet there is a crucial distinction between evidence and assumption. We can identify ancient operations and surviving patients, but we cannot always know exactly what the surgeon believed, what they administered, or how the procedure unfolded. The biggest surprise is that ancient surgery may not have been as impossible as it sounds, because the human body itself gave ancient healers something modern medicine still depends on: an extraordinary capacity to repair damage. Bone can heal, wounds can close, and the immune system can fight invading organisms, meaning survival was sometimes possible even without antibiotics, sterile operating rooms, or modern surgical technology. But that does not make ancient surgery safe. Infection, blood loss, brain injury, and shock could easily turn a procedure into a death sentence, and the archaeological record naturally preserves only part of the story. What makes the surviving skulls so powerful is that they are physical evidence of a human being who endured something we might consider unimaginable, while the people who performed the operation had only the knowledge their world could provide. 5,000 years ago, humans did not have modern medicine, but they already possessed the most important ingredient behind every medical breakthrough that followed: the determination to understand how the human body could survive.
If this journey into the hidden history of human survival surprised you, like the video and subscribe to Zexa for more mysteries buried inside our past. And tell us in the comments, would you have trusted an ancient surgeon with your life? Because the deeper we look into ancient medicine, the stranger the evidence becomes. And the next mystery may reveal just how much ancient humans understood long before modern science caught up.